Hello everyone, I am Dr. Queen Aditya, Senior Consultant Gynaecologist at Papilio Clinic, Kolkata. Ideally speaking, when we are thinking of a pregnancy, it is best to consult your gynecologist. That's because there are so many conditions that need to be discussed before you are actually embarking upon the pregnancy. First of all, you might be suffering from certain diseases which you are not even aware of. So when you go to your doctor for a consultation at the time of contemplating a pregnancy, then the doctor might ask you to get a few tests done. Like simply if your blood pressure is checked and it might be seen that you have a high blood pressure, that needs to be tackled. A few blood tests including blood sugar can show whether you are diabetic or not. Your thyroid status is also very important, because if you are suffering from high or low thyroid problems, then that may also cause a problem during pregnancy, and it can even cause problems in conceiving. So these things are the normal things that are to be checked. There is a viral infection called Rubella, which if contracted during pregnancy, it can be transmitted to the baby, and the baby can suffer from severe congenital malformation which is even incompatible with life. So it is always best to get the rubella status checked, and if one is not already immunized, then it is best to immunize vaccinate the woman with that particular vaccine, with the rubella vaccine, and she is then asked to avoid pregnancy for the next 3 months. Then also the HIV status and status of hepatitis B and other viral infections are also checked. It is better to see whether we are suffering from any sexually transmitted disease or not. If so, then those can be controlled. So these are basically the diseases. Sometimes we are suffering from anemia which we are not even aware of. That can also get detected by simply checking the hemoglobin. If the hemoglobin is found to be less, then we should test for thalassemia minor. This is a test that simply will let us know whether we have anemia due to deficiency of iron or whether it's a congenital disease. If we are found to be suffering from thalassemia as per the testing, then our partner should also be checked for the same, because if both partners are suffering from thalassemia minor, there is very high probability that the offspring will also will suffer from thalassemia major, which is almost incompatible with life. So these are certain things that we should know before embarking upon pregnancy. Now there are other issues also about our daily lifestyle. When we are embarking upon a pregnancy, we should live a healthy lifestyle. Sometimes in our young age we are living a bohemian kind of a life, and when we are planning a pregnancy, these things should change a bit. We should avoid too much of late nights, we should avoid too much of junk food, we should exercise properly and have nutritious healthy food. We should give up alcohol, smoking and habit forming drugs in this period when we are mentally and physically preparing for a pregnancy. So these are very important issues which need to be addressed. There are certain medications which we might already be taking. Suppose someone is hypertensive or has diabetes or has a thyroid problem, then they need to be given certain medications which are possible to be continued during pregnancy, because there are certain medications, as for example during before a pregnancy, if someone is on a medication like enalapril or captopril or these groups of drugs which are ACE inhibitors, they might be contraindicated during pregnancy. So this particular form of antihypertensive needs to be changed to a safer one, which if continued in pregnancy will not cause any harm to the baby. So these are the issues that we should always think about. Then there are so many other kinds of medications which some people might be on. As for example, someone might be on an anti-epileptic which is contraindicated during pregnancy. So when we are planning a pregnancy, then our doctor can change that to a different form which is milder and which will not cause any harm to the baby. Similarly, some people are on antidepressants and so many other kinds of medication which might be contraindicated during pregnancy. So when we are planning or contemplating a pregnancy, it is always better to discuss this with our doctor, so that either it is changed beforehand, or as soon as we realize that we are pregnant, then it should be immediately switched from one form to the safer variety. So these are a few things that we are to do, and as I already mentioned, the vaccination is important in case of rubella, and some people also go for a flu vaccine beforehand, and checking of the viral markers like HIV, hepatitis B, these, as I have already mentioned, are very important. We have to start a healthy lifestyle, proper sleep, good nutrition, and in a nutshell, these are the things that we should look for before pregnancy. And another thing is that usually when we are planning a pregnancy, doctor usually starts the person on folic acid. This is to prevent any form of neural tube defect which might be lethal to the baby, and so it should be started at least 3 months before we actually conceive. So these things are always to be kept in mind, and hence after this entire discussion, I am sure everyone is convinced that we should not go for a pregnancy just like that. We should, when we are planning, it is better that we go to our doctor and talk about it.